Good to have you with us here on the Youth Day edition of the South African Morning. I'm Gareth Edwards, heading up very quickly towards 8 o'clock. Now, as provinces are continuing to record high numbers of new COVID-19 infections, hospital admissions, as we know, go with the numbers, so they've also increased. Experts warning this third wave could be worse than the first two. Well, let's speak to a health expert from Johannesburg. It's Dr. Aslam Dasoo from the Progressive Health Forum. Dr. Dasoo, it's always a pleasure speaking to you. I know you would have watched last night's family meeting, just like the rest of the country did. If I ask you this, with this background, many African countries have gone through an increase in numbers. Their health sectors have begun to collapse. As a result of that, we've seen interprovincial travel cancelled. We have seen international travel cancelled, schools closed, alcohol's banned, churches closed, and I can go on and on and on. And it seems to make a difference in that country. Do you think the president is being too soft in handling this? And by doing that, he's putting professionals like you under pressure.
Good morning, Gareth, and good morning to everyone there. I must say, I thought the president struck a very somber note yesterday, and it's probably out of a realization of the seriousness of the situation we find ourselves in. I also think that there's very little room for the government to make too many restrictions at this point, given that the economy has contracted in the way it has due to the lockdown measures implemented over the last 15 months. And with that in mind, and the impending, well, we are now in the third wave, it's no longer impending, it would have been much better to have gone with the decisive intervention, and that is vaccination. Now, we are probably we have one of the lowest rates of vaccination in the world and one of the highest rates of mortality in the world. And this is a correlation that's unfortunate in the country at the moment. However, he did strike a slightly more upbeat tone with respect to vaccine supply improving over the next few weeks. Now, that is a hopeful thing, and I think we must be a bit focused on that. In the meantime, we have now to get ourselves through this third wave, and unfortunately the burden of that now falls on the population itself. We know what it takes to apply personal protective measures, but I think the additional measures announced last night will go some way towards limiting movement, which is probably the most important risk mitigation factor at this point.
When it comes to the vaccine rollout, Dr. Dasoo, you brought it up just a moment ago. If we were on track with what another similar country in our situation would be, many other African countries, etc. Do you think it could have been a case of us avoiding a third wave if vaccinations were done properly, or would the third wave just not been as bad? Help me understand medically what that would have looked like.
Okay, so if we had a higher number of population vaccinated, there definitely would have been an impact on both the amplitude, that's the height of this wave, and its extent as well. But we would have definitely had a third wave, and this is in keeping with the way respiratory viruses spread. And we know that the seasonal adjustments occur, as we know with flu as well. And so this is not surprising, but we would have definitely attenuated this wave had we had a much higher level of vaccination. As it is, we should have certainly prepared our health system to absorb this impact, and it's quite a severe impact in Gauteng, especially with the curve steeper than anything we've seen before during this pandemic. And that may be driven by a number of factors. But to come to your major point, yes, it would have definitely helped us with this third wave, but it wouldn't have avoided it, unfortunately.
Let's talk, before I say goodbye to you this morning, Dr. Dasoo, in the last minute or so I have with you. When you say prepare our healthcare sectors better, just in a nutshell, what could we have done differently leading up to this third wave, considering we've been through all the levels of lockdown, and the whole point of lockdown was to get our healthcare facilities ready for what we knew was coming? It clearly isn't right at the moment. What do you think we need to do as one piece of advice to the President and the Health Department today, saying to them, this is what we need to get done?
Okay, so I think they know what needs to be done in the health system per se on the ground. I think the supply of resources must be speeded up. I'm very pleased to hear that our oxygen supply to most facilities have been jacked up, so I don't think we're going to have too much of a problem there. However, the worry is really here in Gauteng, where the biggest hit is happening, and our health services are highly beleaguered. With the closure of Charlotte Maxeke Hospital, 1,000 beds are taken out, 150 ICU beds are taken out of the system. And the burden then on the other hospitals is immense, together with the infrastructural problems, which you might have heard of, the water supply issues, electricity, in major teaching hospitals, in a major center like Johannesburg, is really untenable at this point. So the burden does fall, I believe, on the health workers again. And the president should make an effort to improve their morale in whatever way he can, because we have a Ministry of Health that's in disarray at the moment, and so it would require the authority of somebody like President Ramaphosa to make common cause with the health workers in the front line, bracing themselves for this enormous wave we are now experiencing.
Well, I appreciate your time in speaking to us this morning. It's always a pleasure. Dr. Aslam Dasoo from the Progressive Health Forum here.